So today we're going to go over the Medicare presentation for a new client going on Medicare. So the first thing I do is I check to see if a client has received their Medicare card. And so the question is going to be, have you received your Medicare card? And typically it's either a yes or a no or I don't know. So if it's a yes, then I say, great, do you have it with you? Go ahead and get it out and have it in front of you. And even if I'm on the phone, that's what I instruct someone to do. That way at the end of the presentation, my goal is to help them with their applications. And so if they tell me no, then I ask them, well, are you collecting Social Security benefits? If they tell me yes, they are collecting Social Security benefits and they're within 3 months of their Medicare effective date, I tell them that more than likely they have received this Medicare card and it's probably in their pile of mail that they've received about Medicare benefits. And so I ask them to look for it, but let's continue with the presentation. But to call me later and let me know if they find it. So if someone says, I absolutely have not received my Medicare card and I believe that they should have received it, then I instruct them to call Social Security and to inquire on when it was mailed. And if it was mailed in, ample amount of time for them to receive it, I tell them to reorder their Medicare card. At this point, I also tell them that they can create a mymedicare.gov portal and they can get their Medicare card there. They can print off like a temporary card. And the other thing that they can do is they can call Social Security office. And I always recommend that you call your local Social Security office and you ask them to mail you a letter with your Medicare number on it. And they can't give it to you over the phone, but they will mail you a letter with your Medicare number on it. And so that letter typically comes between 4 to 7 business days to the client, and then you just tell the client to give you a call when they have their Medicare number and you can help them complete the enrollments for the Medicare supplement and prescription plans. And so this is the first thing, and I try to create a story, especially if someone is either turning 65 or even if they're post 65, we try to create a story and figure out why is the client needing coverage. And so my second question to the client after I determine whether or not they've signed up for Medicare is, what insurance do you have today? And they can either tell me that they have Medicaid, they might have an employer plan on their own employer plan or their spouse's employer plan, or they typically might have like an ACA individual type of plan. And so that conversation, depending upon what kind of insurance they have, leads to another question. And so if someone has Medicaid, I immediately think they might be eligible for different financial assistance programs through the state or the federal government. And so typically I try to find out what level of income they have so I know how to determine and guide them to what financial assistance they can get. And it also helps me know, can a client afford a Medicare supplement or not? And so that, that's what we're in the business of helping people with, our Medicare supplements and prescription plans. And so if I determine that a client, based upon their Medicaid eligibility, is eligible for like a low income subsidy or extra help, then I kind of stop my presentation right there. I direct them to go apply for all of those types of benefits first, and then to come back to me with what they're eligible for. And depending upon what level of low income subsidies or like the QMB or the SLMB, depending upon what they're eligible for, will tell me what I can help them with. Remember, the QMB pays for the full Medicare premium and it helps pay for the deductibles and co-payments under Medicare. And so when someone is eligible for the QMB, you're not going to get a Medicare supplement policy for that client. Now, you could possibly still help them with a prescription plan, but we would need to know like what level of low income subsidy, which is called extra help, that they're eligible for before you help them with a prescription plan. You don't want to work on a prescription plan without knowing what level of extra help they're eligible for, because the extra help changes the premium, it changes the cost of the medications. And so whenever you find out that that's the case for a client, you always direct them to social services, not Social Security, but social services, to find out what income subsidies they might be eligible for. So let's say a client says that they are eligible for, or that they have employer-sponsored coverage. And so the reason we ask all of these questions is because we don't want to go through the entire presentation and then find out, oh, they're eligible for Medicaid, or oh, they're going to stay on their employer plan. And so you kind of do like the history of what the client has, and to kind of determine what you're going to help your client with. And so if a client tells you they have employer-sponsored coverage, my next question is, do you plan on staying with that employer-sponsored plan? And yes or no. And so yes, I plan on staying covered because I'm covered 100% may be the answer for the client. And so a lot of people call in because they just think that they need to enroll into Medicare, but yet they're employed or they're on their spouse's employer's plan. And so it's not always necessary that you enroll into Medicare when you have employer-sponsored coverage, as long as you're an active employee. And so that kind of depends where the conversation goes as well. The other typical insurance that someone might have is ACA coverage. If you have ACA coverage, then you're not eligible for the tax credit or the coverage when you become eligible for Medicare. So at that point, you know you can proceed with your presentation. Then I would get into Medicare. The first thing I try to do is I try to help them relate their Medicare Part A and Part B to their current coverage that they have. And so whether it's Medicaid, whether it's employer coverage or ACA coverage, I say, I want you to think about Medicare Part A and Part B because they are together, they work together as kind of how your insurance works today. Your insurance today has a network of doctors. Your insurance today more than likely has a deductible, it has co-payments, or it has like a co-insurance, which is a percentage, and you're responsible for paying a premium for your insurance. You're responsible for paying the deductibles and the co-payments. And so Medicare works the same way. Medicare has broken down their parts, the original Medicare, into two parts, Part A and Part B. And the point of showing this, going over these benefits, is to show you the value of your Medicare supplement plan. And so just like your insurance today has a network, has prior authorizations, so does Medicare. Medicare also has deductibles and co-payments. So under original Medicare Part A, that's your hospital insurance. And so you want to define hospital insurance. So if you have a hospital stay over 24 hours, your claims will be submitted to Medicare Part A. And so try to create a story for the client. So if you go into the hospital and you're in the hospital for 4 days, you typically would be billed a deductible of $1,484. However, if you have the Medicare supplement plan that I'm recommending to you, that Medicare supplement plan is going to cover it 100% for you. If you ever stay in the hospital consecutively, 61 through 90 or 91 through 150, there's a copayment per day for those services. And so typically when I'm over the phone, I don't spill out those numbers. I just say there's a copayment per day that your Medicare supplement plan is going to cover for you. And then I move forward. The next step of coverage is skilled nursing care. And so in skilled nursing, Medicare pays 100% for days 1 through 20. And then normally if you did not have a Medicare supplement plan, you would be responsible of days 21 through 100, which is $185.50 per day. If you take the Medicare supplement plan G that we're looking at today, that copayment would be covered 100%. And before I move forward to Part B, I review what I've told them. So what I'm showing you is if you have Medicare Part A with a Medicare Supplement Plan G, you're going to be covered 100% if you have a Medicare approved hospital stay. All the deductibles and co-payments, including your skilled nursing confinement co-payment, all covered 100% under your Medicare Supplement Plan G. Then I stop, I pause. Do you have any questions? Yes or no, depending upon the client, obviously. Medicare Part A is free for most cases. The other thing I try to explain to people is what skilled nursing facility care, and that it's not custodial care. And so skilled nursing facility, the way I define skilled nursing facility, is inpatient rehabilitation. And so be really clear. And the way I try to hopefully help clients understand is that if you are getting better, Medicare should cover it. If at one point you stop getting better, and I've even had people refuse care, Medicare stops covering. And so that's something really important to understand. So then we move to Medicare Part B. As long as the client understands Medicare Part A and how their supplement plan G works with Medicare Part A. So then you have Medicare Part B. Medicare Part B is for all of your other services that are outside of the inpatient realm of Medicare Part A. So your doctor's visits, your lab work, your x-rays, your imaging, your durable medical equipment, things like that. So the first thing I tell a client is this is the first thing you're going to have to pay for. is your Medicare Part B premium. Each year the premiums change from every January normally. They don't always change, but they can change. And so I disclose that 2021's premium is $148.50. And if you have a higher income, then it's possible that your premium will be higher as well. And so I ask the client to get a piece of paper out, normally in the beginning of the presentation if I'm doing it over the phone. And at this point, I tell the client, can you write down Medicare Part B and write $148.50 beside it? Because that's the first premium that is your responsibility. And typically that client is like, well, how am I going to pay that? And so if you remember from previous trainings, a client would pay that premium if they're collecting Social Security, it's going to immediately come out of their Social Security check each month. If they're not collecting Social Security, again, they'll be billed quarterly. And so then I talk to them about the Part B benefits. And so with Medicare Part B, you have an annual deductible. I define annual. Annual is a calendar year deductible from January to January. I also disclose at this point that that deductible can change every January 1st. And to expect it to change because it has been changing for the last several years. There has been a couple of years where it stayed the same, but the trend has that it's been changing almost every year. So with Medicare Supplement Plan G, the Part B deductible is not covered. And so I make sure that they understand that this is a deductible they'll pay. And so I create a story for them. So that means that if you go to the doctor, your doctor's going to bill you for the services that you incur. And so if your doctor's visit is $76, your doctor's going to submit that claim to Medicare. Medicare is going to say the client hasn't paid their Part B deductible, and it's going to come back to the doctor, and then the doctor will bill you $76. That $76 will go towards your $203 deductible. And so as you incur outpatient expenses, that's how your deductible is paid. And so maybe it's one doctor's visits, maybe it's 3. So it just depends upon how many or what the cost of the outpatient services that they're having. But once that deductible is paid, then Medicare kicks in and pays 80% of all approved Medicare outpatient services. And so that's what the client is paying for. So I do try to remind the client that that's the premium you're paying. You're paying for this 80% coverage, which is great coverage. 80% is a lot of a bill. And then this remainder 20% would be billed to the Medicare Supplement Plan. And so then at that point, I go back to the Medicare Supplement chart and I highlight all the things that I just went over. If the client has this in front of them, I ask them to highlight it. And so typically over the phone, I've asked the client to get out a piece of paper. I have asked them to write down the Part B premium, which is $148.50. The second thing I'm going to ask them to write down is the Part B deductible, which is $203. And I tell them to write beside that, I pay this. And so I want to make sure the client understands that that Part B deductible is their responsibility. The other thing that you disclose about the Part B deductible is that the deductible can start over every January 1st. So for clients that we're selling between now and December, we have to absolutely make sure that they understand that because it will create a lot of customer service phone calls. And I will tell you, even if you tell them, they're probably still going to call. But it's okay, just to remind them again, you have that Part B deductible. A lot of people call it their Medicare supplement deductible. It's not their supplement deductible, it's Medicare's deductible. And so it changes every January 1st and starts over. And so before we move forward, I try to make sure that the client understands Medicare. I try to make sure the client understands how their Medicare supplement is going to work, and I ask them if they have any questions. The other thing I try to get them to do is to agree that this is the plan they want to go with and that this price is okay for them. And so once we've moved forward from that, I move to the Medicare prescription plan. So typically I have the client's prescription list in front of us, and that's how I work when I'm doing the presentation over the phone. And so I explain to them what I've done. I tell them that I've gone to Medicare.gov. I've entered all of your prescriptions into Medicare.gov database. And what this system does is it searches all the Medicare prescription drug plans in Maryland or Delaware, whichever state we're working in, and tells me which Medicare Part D plan is best for your specific drugs. So I will help enroll you in it. The premium, I go over the premium, I go over the deductible again, and then I go down and tell him what the co-payments are for his drugs. So the next step that after you go through like the Medicare A and B and the supplement plan and then the prescription plan, you ask them if they have any questions. And then you review with them the premiums again. Medicare Part A is free. Medicare Part B is $148.50. Your Medicare supplement's $139.57. Your prescription plan $65.90. If you're okay with my recommendations, we can proceed with an application to apply for all of these plans. And so that kind of tells you whether the client's ready or not. And that's usually how I word it, is if you're okay with my recommendations, the next step is to apply for them, is to complete applications and apply for them. Thanks for joining in today and learning more about Medicare. If you'd like, click more of my videos and we can learn about Medicare together.